I want to introduce the Singita Lowfeld Trust and Shirley Kuna. So the Singita Lowfeld Trust are a client of Data Drive who did their first ELOM study last year. They're also currently preparing to go into the field for end-line data collection. So I'm very excited to have them here because they have the fresh eyes of people who've only just started using these tools and learning using ELOM. Singita Lowfell Trust began as a registered public benefit organization that aimed to support communities in the villages neighboring the Singita Sabi Sand Reserve and the Singita Kruger National Park region. Over the past 2 decades, the trust has supported various local community initiatives, including a holistic ECD program, which has been part of what they've been evaluating using ELOM. I'd like to welcome Shirley Kuna to this webinar. Shirley has over 17 years experience in the ECD sector, including as a principal and a practitioner, so deeply embedded in the field and in the work that we do. I'm also joined by members of Data Drive team, including our fieldwork sport manager, Nonkululeko Saloba, who I will ask to speak a little bit later. Nonku is the fieldwork sport manager that many of you engage with. You probably know the name, but maybe not the face and the voice, so you'll get to see her a little bit later. Without further ado, I'm going to go ahead and share Shirley's presentation with you, and we can get started. Okay. Shirley, if you could unmute yourself and get started. Shirley, if you're there. Sisipo, can you assist with just getting Shirley unmuted?
Hi, Rambi, can you hear me? It's Linky.
Hi, Linky.
Sorry, we're struggling to connect. Is it fine if Shelley continues from this device?
Yes, please. Just let me know when you want me to move to the next slide, as long as you can see the slides. Sorry, everyone. We're having a case of the Mondays.
Hi, Rumbi. I don't know if
Hi,
you can hear
Shirley.
me. Hi,
I
can
can
you
hear
see
you.
me?
Hi. I cannot see you, no. Can you switch on your video so everyone can see you?
No, it says it is disabled by the host. I cannot start a
All
video.
right.
Mm.
Sisipo, can you assist us, please?
That. Okay, I've disabled that so she can start the video.
Okay, you can start your video now, Shirley.
Okay.
All right, there we go.
Can you see me?
Okay, welcome. Yes, I can see you. I can see that you're joining from your phone, which is not ideal, I know. But let's get started anyway. So Shirley, we had a wonderful conversation before where you were telling me a little bit about how you started in the sector, and what Singita does. So do you want to start there and then just let me know when you want to move to the next slide and I'll do that for you.
Thank you very much, Rumbi. Yeah, I'm joining on my phone, or maybe later I'll switch on to the laptop. I don't know. We'll see how it goes. So Thank you very much, Rumbi. Hi, everyone. My name is Shelin Kuna. I work at Singita Lawfare Trust as an early childhood development trainer. So we work closely with the center managers, the practitioners, and the children. So we support the centers by capacity building and also providing on-site support for the practitioners and the center managers. So my journey in early childhood development started as a practitioner. I've been working as a practitioner at one of the ECD center in my community, which is Wisani Daycare. I've worked there for 17 years. So actually, I passed my matric on 2021 and went straight to the ECD in 2022. So I worked there for 17 years with different age groups of the children. So I later joined that I say law firm. I'm sorry about that. I think I'll move to the laptop. Just a sec.
Okay. Please bear with us, everyone. It has been a little bit of a struggle with the network today. Okay, Shirley, I can see you. If you just unmute yourself.
Okay, cool.
There we go.
Thank you so much, everyone, and my apologies for that technology. Yeah, so I was saying that I later joined the ELOM Trust as a trainer, where I conducted several workshops with the center managers and the practitioners, and also then did a training around the accredited NQF level 4 qualification for the practitioners. So I joined Singita Lawfare Trust this year, January, where I work as a trainer. So thank you very much for the opportunity given to share with you our experiences as Singita Lawfare Trust on the ELOM fieldwork. Thank you very much, Rumbi. So we can move to the next slide without waste of time. Thank you. We can move to the next slide, Rumbi, please. I think for me, the screen is frozen. Nothing is moving. So,
Sorry, Shirley. I'm just trying to move the slide. There we go. Oh,
thank you very much. So,
if we just
I
go
want to
back. Sorry. My screen was frozen and now there we go.
Okay, thank you very much, Rumbi. So I will be sharing the practice and also the tips for conducting ELOM. So I'll first give a little background on our journey to ELOM as Singita Lawfare Trust. So Singita Lawfare Trust has embarked on this ELOM journey after spending over a decade supporting early childhood development, which is ECD, centers in the Greater Kruger region. So we did all this because we wanted to answer these two questions since we are supporting the children. Are these children developing? And is the ECD program being offered of good quality? So those are the questions that we wanted to get answers to. So in 2025, Singita Lawfare Trust did the LPQA and the dipstick assessment across the 17 ECD centers, just to get an overview of the program and its impact on the ground. So by doing so, it made us realize that there is actually a need for us to conduct both the baseline and end-line assessment so that we can get a fuller picture of the program. So hence, this year, 2026, we did ELOM 4 and 5 baseline assessment with 27 ECD centers. Why 27 ECD center? It's just that we have absorbed new 10 ECD centers, which added to the 17. So now we are supporting 27 ECD center. So we did the baseline with the 27 ECD center, and we are planning to do the end line across all the 27 ECD centers this coming October. So with that background, I think we can maybe take you through to our learnings, what we have learned during this ELOM journey. Thank you very much. We can
Sure.
go to the next slide, Rumbi, if
Sure.
we are still together. Thank you very much. So we're gonna share what we have learned in the field. So there are some things that has worked well for us during the field work. One of it was having Xitsonga Shangani speaking assessors who are also ECD practitioners. This was very, very great for us. It was very, very beneficial for us. Why? Because assessors understood both the language and the ECD environment. So they will communicate naturally, with the children as well as the practitioners that we were working with during the assessment. And it also helped the children to feel more relaxed and comfortable around the assessors, because they were interacting with people who kind of understand their context, who they are familiar with their context. So another thing that worked well for us, it was keeping the constant communication with the centers. So we kept them informed about everything from before the assessment, during the assessment, and after the assessment. So we did all this to make sure that they understand what is expected from them or what to expect, and also for them to be able to prepare the children appropriately for the assessment so that it will run smoothly. Because when you have to do the assessment, there is a process of ensuring that parents sign the consent forms, making sure that there are eligible children ready for assessment. So that's why we make sure that we keep that constant communication with the centers. So it didn't end there. Another thing that has worked well for us that we are proud of is that we kept the communication going. When the results came out, we made sure that we have one-on-one feedback session with each center, trying to explain to them or interpret those results to them so that they get to understand what they mean, rather than giving them the results and letting them to figure it out on their own, what they actually mean. So that worked very well for us. So in 2025, when we do the dipstick with the 17 ECD center, everything went well because we had enough eligible children to be assessed. So this shows the importance of communicating the eligibility of the children with the centers in time so that proper preparations are made. So another thing is just that most of the children were interested to interact, to engage with the assessors during the assessment. I think maybe because most of the activities in the assessment tool, they are playful, they are joyful for the children. It's something for them, it's like it's a play to the children. So they felt more relaxed and comfortable around the assessors, and it created that relaxed environment for the children to do what they can do, and for the assessors to be able to observe the children naturally and record what they can do. So lastly, it's the importance of this assessment. It provided us as a team with a practical experience in administering the ELOM tool, and also strengthening our understanding on the assessment procedure, because we know that we have to follow the instruction consistently when doing the assessment. Thank you very much, Rombi. We can move to the next slide. Thank you so much. So, although there were things that have worked well for us, I can say that the assessment also came up with some challenges, which became a learning for us. Because when there's a challenge, you need to find a way of improving that challenge for future assessments to run smoothly. So the first challenge that we encountered was the movement during the assessment, or the movement in the assessment area, because you'll find that the center staff, they just walk in and out during the assessment. Sometimes they come in to check how things are going with the assessment, or maybe to call the child who's being assessed for breakfast or something like that, which is kind of understandable um, according to the center perspective, because yeah, for them it's normal. And I think they were worried. They were like, what is happening in there? Hence they come in and out. So we needed to emphasize to them that the ELOM assessment is not about selecting children who can do well, because for them, they kind of like wanted to select children whom they think maybe they can do better in the assessment. So there was a need for us to emphasize to them that ELOM assessment is not about selecting who can do better or do well, but it's about understanding the children for who they are. So I think there is a need for clear communication around that, around the purpose of the assessment, and also the selection criteria, so that it is clear for the centers, or it's clear for the center managers and the practitioners in that manner, so that they can just relax during the assessment. So another challenge that we came across was beside the concerns for the performance of the children, and beside for them coming in and out during the assessment. Another one, it was the language around the assessment test. So we found out there are some errors in the assessment test that read slightly different to the one we used during the trainings. So that is something that I think maybe a data drive can get someone to look at both the tests, just to ensure that the language is, yeah, everything is okay. So another challenge, it was around the eligibility of the children. We have experienced the change of eligibility of the children in the middle of the assessment. So at some point, there was some kind of a clarification that children who are born at 2021 to 31st, 2022 were eligible for the assessment. Meaning most of the children whom were initially recommended to be eligible for the assessment, then they were no longer suitable or eligible for the assessment. And it affected the assessment just because there were children who were already assessed by then. We know that they were eligible. But when this clarification came, it affected the whole thing, because some of the children who were already assessed, they were no longer eligible. So I think it highlights the importance of clear communication around the right age, the eligibility of the children. It needs to be clearly communicated with the centers, with the organizations who are doing this ELOM assessment, so that the process will run smoothly. So the last challenge, it was around a request for explanation on low scores. Yeah, even though a detailed comment is being captured on the assessment form, but you'll receive a request of it also shows that there is a need to have a clear communications around the meaning of the results and how it should.
Sorry, Shirley, you're breaking up a little bit. I'm not sure if that's just for me.
Yes, Rumbi, she's breaking up a little bit. She should be getting
Okay.
back in just a few.
Oh, Okay, sorry, Shirley, I think you froze. Did we lose Shirley? Okay, there, you're back, but you're muted. There
I'm
we go.
back now.
Okay.
Yeah, I think this network is playing games with us, but anyway, we'll get there. Thanks very much, everyone, for your patience. Yeah, I was on the last challenge highlighting the importance of clear communication on what actually the results means and how they should be interpreted. Yeah, throughout the assessment. So these are the things that we have come across, the challenges, and also the suggested ways of improving it. So thank you very much, Rumbi. We can move to the next slide, please. Thank you. So we are going to look at the language of assessment. There are few things that we have learned around the language. So first one is that a familiar language supports the understanding of the children because we all know that children are more likely to understand and respond confidently when the assessment language is familiar to them. So when the assessors are trained in a language that are familiar to the children, it's easy for the children to interact and to engage and also to understand what is being asked of them so that they respond naturally rather than asking them a question or something in a language that they don't understand. So you'll find asking yourself, is the child struggling actually to answer the question, or is just that they don't understand what you are saying because of the language being used. So as Singita Lawfell Trust, hence we trained our own Xitsonga speaking assessors, 11 Xitsonga speaking assessors, which is consisting of the 7 Singita Lawfell Trust staff, which is the classroom facilitators and the trainers. So I'm one of the trainers. And 4 practitioners from the 27 ECD centers, which or that Singita Lawfell Trust support. So, and we have discovered that the reading of the actual assessment activities instructions to the children in the language that they understand, or in Xitsonga, as I'm a Xitsonga speaking, I'm a Xitsonga ELOM assessor, it gives a sense of a command to children's attention. They pay attention to what you are saying just because you are using the language that they are familiar with. So it's easy for them to relate to whatever that you are trying to tell them or trying to show them. So we have seen children engage, interact with the assessors in a very beautiful way because the language that we used was familiar to the children. So this highlighted the importance of using the language that is familiar to the children. It will make the assessment to run smoothly, makes the children to feel relaxed with the assessor. I think, yeah, that's some of the things that we have noticed, that we have learned around the language of assessment. If you want children
Thanks,
to
Shirley.
listen to you, use the language that they can hear, that they are familiar with, then it's easy to communicate with. Thank you very much, Rumbi.
Thank you.
Thank you. I think we are on the last slide now. So this is some recommendations that we are bringing to any organizations that might be planning to go through this ELOM journey, or they are planning to do the ELOM assessment. I think one of the important thing is around building the capacity. Uh,
Um, Shirley, I think you're frozen. I think we've lost Shirley? Is it just for me or everyone else? Okay.
For everyone,
Okay.
Rumbi.
Oh my God. I don't know,
I think
Rumbi,
we've
if
lost Shirley.
it's only
I'm going
me.
to just, you're back?
Yeah, I'm back.
I think the
I'm,
network is, yeah, the network has been pretty
yeah,
bad.
yeah.
Shirley, can I just ask you in like 2 minutes because we're fast running out of time as usual. Just in 2 minutes, what what would you do differently about field work, especially if you think about the first time that you guys did it? So not just this year with the baseline assessments, but what would you, if you had the opportunity to wave a magic wand, go back in time, what, and there was one thing you could do differently, what would it be?
I think it's around making sure that parents signs the consent form,
Okay.
because without the consent form, there is no assessment.
Okay.
So one thing that I can go back and fix if I had time is to ensure that we change the way, or we find a way that will make parents uh, sign those form and bring it back to the center as soon as possible. How
Hmm.
can we do
Hmm.
that? I think the best way is through uh, parents meeting. Yeah, I think it's through
Okay.
parents meeting in the ECD center. During that
Okay.
time, we give the parents the consent form, explain to them what is happening, and then those who are willing, they sign the consent form right there and leave the form
Mm.
right there.
Okay. Yeah, I mean, so one of the things that we suggest, and Nonks, you'll be able to jump in here, but you want to distribute as many consent forms as you can to the broader population of the children who you might assess. You're going to aim to get more consent forms back than you need, actually. So I agree. The idea with your consent forms is to over plan because you might find on the day of assessments that there are children who are ill, or there are
Yes.
children who don't, their parents consented, but the children themselves are not interested. So
Hmm.
you should always plan for that. Nonks, I just want to bring you in here if you wouldn't mind switching on your camera and your sound.
Okay, my camera's on.
Oh, okay. I don't see you.
Sorry. Yeah.
Oh, there you are. Okay.
Yeah.
Okay. Everyone, this is Nonku who is the fieldwork support manager on our team. Nonks, I just want to ask you in just a few minutes if
Mm,
you could just respond to some of what Shirley has raised and maybe add to it because I know that you bring into this space your your expertise generally as a fieldwork manager, but also the deep experience that you have in working with assessors. So I'm
yeah.
just going to hand over to you for just a few minutes.
Okay. Did she write the question somewhere or it was on
No,
the presentation?
no, so I'm just asking you to speak to some of what you've learned about ELOM fieldwork.
Okay. The first thing is preparation. You can never prepare enough, just like you stated in the previous remarks that you said. Concept forms you should send plentiful out and ensure that you have communication with the principals because you might think that the day that you plan the principal might be available and only when you get to the ELP you find that there is an event or they have an excursion or there's even like a measles breakout. So you should always be prepared. And also, communication is key when you're communicating with your assessors. Ensure that the tools are always in order. There's nothing missing from their kids, and they travel. The travel time is very important. They should always plan ahead because just for unseen purposes where they can be planned, they might have planned to go to a certain ELP for the day and there's a strike or the principal feels like they shouldn't go there and then there should be always options available. Communication is key.
Something else that I know that we've spoken about as a team is that there's some critical fieldwork roles that you have to make sure that
Mm,
you've planned for and you've filled.
mm.
Can you speak a little bit about the importance of the fieldwork manager role?
Okay. Having a field manager is very important. Someone that is solely focusing on the project, someone that's not in field, someone that's not focusing on another task whilst the team is in field, because that is very important. There could be a form change that the field manager has to attend to, and even just planning. So the field manager has to know all the forms that they're using, just to pick up certain things where you might find that there's a certain module that you did not mistakenly put in the survey. If a field manager is focused and is solely focusing on managing the field work for the team, they can easily pick that up, other than that being picked up at the end when now we are doing the reporting or meet the project, whereas we have now to go back and fill in those questions that have been missed.
Okay, thank you. I'm gonna just move into questions because I know we have quite a few, but yeah, so I can see that Mildred's raised her hand. Um, Before we go to Mildred's question, Shirley, there's a question for you in the comments around the hidden costs. And I think that this is something that you can probably speak to, and Linky, who I know is there with you, can speak to. What are some of the hidden costs that you didn't anticipate when you were thinking about doing field work around, you know, the financial costs, time, money, some of the challenges that maybe delayed your assessment schedule? What are some of those costs that people need to just have in mind?
Thank you, Rumbi. I think Linky will answer that one.
Okay.
Hey. Hi, everyone.
Hi, Linky.
I think the hidden cost could be around the fact that we didn't have a project manager specifically for this particular assessment. So it would either be myself or Maurice, who is our project manager, running
Hmm.
around. And there are certain things, obviously, there's only so much planning that you can do. But there are certain things that when you work with people, there are a lot of unknowns that pop up. So yeah, I would say it was around those kinds of situations, like Shirley mentioned earlier. So like the change of the eligibility of the children, and maybe arriving in the centers, the weather, children aren't there, and then having to go back to the center to find the 20 that were needed for. So yeah, those kinds of stuff. And because our centers are spread out across two regions in Mpumalanga, so having to drive and going back maybe to the southern part of this, of the region, and then having to go to the northern part of the region. So those sorts of things that you didn't necessarily plan for. So it's almost like budgeting for the unknown in future. Thanks.
Yeah, thanks, Linky. Mildred has her hand up. Mildred, would you like to unmute yourself?
Good morning, everyone. Hello, Shelley, and thank you for your comprehensive presentation. You mentioned that you did assessments for the 4 to 5 in 27 ECD centers. How many children did that equate to?
Thank you very much for the question, Mildred. I'm not sure of the numbers, 400 and something, because we assess 20 children per center.
Okay. Yeah, no, I was just
I
interested.
can
Yeah.
Rumbi
I
will
can
know.
probably answer.
Rumbi will
It
know,
was
I think.
large. I will. It was just under 400, yeah. Or maybe
Yeah.
just over, but it was around between 350 and 400, yeah.
That's quite a lot of children. Okay. Yeah, you also spoke about children actually falling out of the age category probably when you get to the end line, because we also been doing ELOM now, the baseline and end line, I think, for 2 years now. Yeah, so it's, as you mentioned, it's important to actually, I would say, calculate the age at baseline to just ensure that by the time you get to end line, those children fall within that age group, again, the 60 to 69 months, and communicate that clearly with the principal. So you will stipulate, we want children born in this month up to this month, so that at least you have that same cohort by the time you do your end line. Thank you.
Thank you very much
Thanks,
for that,
Mildred.
Mildred.
Thanks,
And maybe
Mildred.
to clarify, we did the dipstick in 2025 around September, October, somewhere there. So the children were eligible. So we had never done a baseline before. So hence, the change in age, it was something that we were not aware of. So that's where that is coming from. So by the time we get to the end line in October, I'm sure that all the children will be eligible and they don't have to send the consent forms anymore. So that is very good because it's already done. Thanks.
There's a question from Brian. Brian Zata. Would you like to unmute yourself, Brian? Question about fidelity.
Yes, thank you for that. My question is more about how do you do your observational fidelity?
Can you elaborate? What do you mean by observational fidelity?
I know that you follow a specific process, as you mentioned, with being an accredited assessor. But when you do the field checks with the children, how do you observe the children as they implement?
Okay.
Am I making sense?
Yeah, so look, I mean, I think maybe you're thinking of a different process. So the ELOM assessment process, and the assessors will know, involves, it's a one-on-one 40 to 50 minute individual assessment of a child where you take
Yes,
through
that's
a
exactly,
number
yeah.
of activities. So, and I think Shirley alluded to it, that when you are in field, as you are capturing data, there are flags and checks that come up, that are then picked up by Data Drive, and we're in communication with your fieldwork team around those flags and checks. So there's an ongoing conversation between us and the assessors. I think does that answer the question?
Yes, thank you so much. Thank you.
Yeah. Okay. Okay, there's a question. There's a question which I think is more of a request from Tawanda from Data Drive, to please share the language, any of the language or translation errors that pop up. So the ELOM tools are translated into all South African languages, and as you know, with translations, they don't always capture the nuances of local dialects, and the complications of how people speak in their communities. And so if you pick something up where the translation, it seems incorrect or is off, or is incomplete, please, we ask that assessors be in contact with us throughout their fieldwork. Please let us know as these things come up. I'm going to ask another question, because I think that's come up. Oh, Angela has said, yeah, she's right, that the sample size was reduced from, the aim was 540. You ended up having a total sample size of 448. What are the conditions that made that first study that you did, which was really big, across all of your centers? What made that possible? If you wouldn't mind sharing that, Linky or Shirley.
So, when you say what made it possible, you mean in terms of funding or what?
Funding and other things, yes.
Yes. So Singita is a trust. So but in the same process, we also fundraise through the Singita game reserve properties. So yeah, that's what made it possible. But also we had never taken or considered or even looked at monitoring our program before. So, and after being around the space for over a decade, going on close to two decades now, it was important to, going back to what Shelley was saying, the whole point of doing this exercise is procuring learning resources for the children and doing capacity building. Is the question is, are the children thriving at the end of the day? So if you look at the time that we've been doing this and to only now undertaking the mail and asking those questions. So it took a little bit of time and obviously investing and fundraising. So that's what led to this initiative happening. Lots and lots of fundraising. Thanks.
Thank you for that's a very honest answer. Yeah, and I think as someone said, there's also hidden costs that you don't think of. There's a question here from Zianda, which I think I might direct to Nonku. Zianda says, if an assessor can only assess in the language that they registered in when they were filling in their application form, can they assess in other languages? So just a bit of an explanation on the language process for assessors. Nonks, if you wouldn't mind taking that one.
Okay. Assessors, when they do the training, they first do accreditation and a language test that is taken to workforce. So if the field worker initially said they can only assess in English, they do have an opportunity, but we actually advise against this. They can only assess in a language that they have been accredited in. They are informed of this prior to them even joining the training. If it's an old assessor's way, previously we did not do this, they would definitely have to fill in the language test. I see there's also Miss Ngunyule who's here, who's an old assessor. She had to redo the language accreditation test in order for her to assess in Xitsonga, even though she is Tsonga. Thank you.
Yeah, we're quite strict about that, because as Shirley was pointing out, it really is important that the children are assessed in a language that they're familiar with. And if you are not accredited to assess in that language, then the flag does come back to us, and it could lead to data being excluded. There's a question here from Tapelo who wants to know how much time does an assessment take to be completed. Shirley?
Thank you so much, Rumbi. It's 45 minutes.
Yeah, it's 45 minutes. That's kind of the average time. It can be a little bit longer, but obviously there are flags that come up on our end if an assessment goes on too long, or if an assessment ends very briefly. Yeah. There's another question here about language. But what I'm going to suggest with that, and I see the question, Linda, and I think you're picking up on the point that we were speaking about around local dialect and the nuance of how people speak in different contexts. Please feel free to email feedback like this, specific feedback about languages to our team. You can email users, USERS, at datadrive2030.co.za. Sisipo, I'm going to ask you to just pop that in the comments so everyone knows to send that directly to us. Yeah. We have 5 minutes. There's one last question here from Tankiso. who wants to know what criteria you used to choose the ECD centers where you did assessments. Did you choose all of them, or did you only work with some of your centers? What criteria did you use to choose those sample assessed centers?
So all the ECD centers that we did the sample, we work with. So Singita supports 27 ECDs, like we said, across the Greater Kruger. So all the children in those ECD centers that were eligible were assessed. Thanks.
Cool. Thank you. Okay, we have 5 minutes. What I just want to just spend the last bit of time talking about is, I think, so maybe this webinar was a good immersion into how tricky fieldwork can be. There's lots of things that you don't anticipate, lots of things that come up, either with technical glitches, either with your sample being available, or things that happen at ECD sites that you didn't know about or didn't anticipate. So I think the overwhelming tip that we have as a team for your work in the field is to just prepare for those eventualities. Always, first of all, just budget more time than you think you're going to need to complete all your field work, and be as prepared as you possibly can, and also to draw on the support of the Data Drive team. We try to create a direct feedback loop. So and those of you who have done field work will know that there are WhatsApp conversations that are ongoing between your team in the field and our team, wherever we're sitting in Joburg or Cape Town. So to please draw on that support. And then also to just, in terms of your energy, your team's energy and your team's time, to budget a lot more than you think you're going to need. Queen, I see your hand, but we're almost out of time. Okay, let's just do one last question from Queen before we. And then I see there's another one also about the social emotional rating scale. Okay, Queen, if you don't, just unmute yourself if you don't mind. Oh, wait, you're muted. Queen? Okay, do you want to go ahead and ask your question? Okay, we're struggling. We can't hear you, Queen, but there's a question here about the social emotional rating scale from Nontobeko. So the social emotional rating scale training is included as part of ELOM 4 and 5 because it's not necessarily a separate tool. It's usually used as an add-on to another tool. But if you are wanting training on tools other than what you currently have, Nontobeko, then please contact us at that email address, and we can either let you know about upcoming trainings or connect you to our training team. Okay, so Queen, I'm afraid we're going to have to move on. I just want to thank you all so much for your patience. I know this has been a stop and start webinar. We are doing this a little bit differently. And also we've had tremendous tech challenges on both sides. The Singita teams had challenges today and the Data Drive team. So thank you for bearing with us. And also a huge thank you to Shirley and to Linky and Angela, who is also here, I can see, also to Morris, to everyone from the Singita team, for just being just so so completely forthcoming in sharing your experiences, and in engaging with us about the things that you found challenging about this work. We really appreciate the engagement and the feedback. This is being recorded, so tech challenges and all, it's going to be available on YouTube in perpetuity. Please share it with your networks. And then if Shirley approves, we'll also make sure that you have those slides from her. If there's any queries that we haven't addressed, or any follow-up feedback that you have specifically on the tool itself, especially those language points that were being raised, please email us. We rely on feedback from the field in order to keep improving the services that we offer. I think I'm going to call it there. Thank you once again, everybody. Thank you, Shirley and Linky. And thank you to Nonku, and thank you to the team supporting us here. Thank you, everyone.